Welcome. Our diverse group, made up of people with Parkinson's, healthcare practitioners and researchers from 10 different countries, have been working for the past 12 months on the topic of building global relationships. The aim of the group is to feed back to the World Parkinson's Coalition about how we as an international community can work together better, share resources, and develop global networks that benefit those in low to middle income countries with Parkinson's.
The World Health Organization tells us that globalization is one of the key challenges facing health policymakers and public health practitioners. Although there is a growing body of literature on the importance of globalization for health, there is no consensus on either the pathways or mechanisms through which globalization affects the health of populations or on the appropriate policy responses.
As a group, we have recognized the multiple barriers that people with Parkinson's disease, their families, and care providers face in low to middle income countries. Broadly speaking, we can refer to the barriers that the World Health Organization have recognized for people with Parkinson's: education, limited therapies, and limited access to universal, appropriate care and treatment.
The general understanding of Parkinson's amongst clinicians is nowhere near as comprehensive as that of other conditions such as cancer or vascular disease, despite it being the fastest growing neurological condition in the world. No less problematic is the lack of neurologists in certain regions. In fact, according to the World Health Organization, at the lowest extremes, there are only 0.03 neurologists per 100,000 population in Africa and 0.07 per 100,000 in Southeast Asia. This is compared to 4.84 per 100,000 population in Europe. Access to the information that does exist is limited in low to middle income countries, and additional difficulties exist due to socioeconomic disparities, geographic, gender, and language barriers.
Lack of effective drug therapies to halt the condition, as well as limited access to allied healthcare such as physiotherapy, occupational therapy, and speech and language therapy, prevents people in low to middle income countries with Parkinson's from realizing optimal outcomes.
To summarise, what our group collectively knows is that A, where you're born has an impact on your access to universal healthcare, and B, digital technology has the ability to upgrade healthcare services in emerging nations. In response to this, our group has had a focus on two things. One, enabling more equitable access to information and resources for people with Parkinson's, their families and carers in low to middle income countries. And two, finding shared challenges and opportunities to address them as a global community.
As a first step towards this goal, we reviewed the large survey that was sent to WPC organizational partners in the summer of 2020 on behalf of all working groups. Upon review of the responses related to resources and availability of these resources, 3 issues became apparent. First, there are many parts of the world that lack access to resources. Second, there is a need to obtain more specific details from organizational partners regarding the types, format, and languages of resources they offer. Third, it would be beneficial to organize a central repository of resources that is accessible by people globally. This central repository would allow individuals and organizations to connect and collaborate without having to duplicate efforts.
To meet the needs we identified, our group decided that our first goal should be to create a more in-depth survey so that we could find more specific details about the available resources that the WPC organizational partners already have available.
This survey asks very specific questions about a variety of resources with the aim to capture information around the whole spectrum of resources that are available, their formats, platforms, and the languages which they are offered in.
The results from the survey will provide multiple and dynamic benefits, including they set a foundation for building a comprehensive database of needed information, materials, and contacts. Streamlining and housing these resources under one roof simplifies and improves the community's access to them. The survey results simultaneously highlighted areas of needs and strengths within the different organizations. This allows communities to learn from each other through the sharing of best practices and the knowledge of what has or has not worked in the past.
Our brief was also to find shared challenges and opportunities to address them as a global community. A step in this direction is the sharing of a case study. This is a collaboration between India and Kenya, which you will have a chance to hear about after this presentation.
A collaboration between the IPDGC Africa, which is the Africa arm of the International Parkinson's Disease Genomics Consortium, and Parkinsons Africa to create and translate culturally relevant Parkinson's resources. These resources will be translated into a dozen African languages to help spread awareness and to increase knowledge of Parkinson's disease across Africa. A third collaborator, Parkinsons UK, granted permission for their informational resources to be used and adapted freely for this project. What this means is that these materials do not have to be recreated from scratch, preserving time and other valuable resources and underscoring the value of collaborations and partnerships.
An initiative to build an alliance between emerging groups and well-established PD organizations that serve the Spanish-speaking PD community in North, Central, South America, and Spain. Alianza Iberoamericana de Parkinson will promote collaborative efforts to educate and empower this large community, like the webinar provided by the Muhammad Ali Parkinson Center in the United States in collaboration with Federación Española de Parkinson in Spain, Saber para Sanar in Mexico, and Actívate Parkinson in Peru, that gathered participants from 15 different Spanish-speaking countries.
A need for educational materials regarding how Parkinson's disease can affect speech, swallowing, and movement was identified, as well as a need to educate speech, physio, and occupational therapists in Africa and South America regarding evidence-based treatments that are available to improve speech and movement. In response to this need, LSVT Global created educational flyers for people with Parkinson's disease regarding speech, swallowing, and movement, and worked in collaboration with Tosh Fothergill Misbah and Claudia Martinez to translate these into Swahili and Spanish. Additional collaboration involved providing free educational webinars to speech, physio, and occupational therapists in Africa and Spanish-speaking countries.
So our ask of you today is not a question, but a call to action. Help us develop a web-based resource for the global Parkinson's community.
There are a few ways this project could be done involving different levels of complexity. Our ideal goal is to gather and classify all the materials in a digital format in a database. We will need funds to involve web programmers and developers to build a web-based system that will allow anybody in the Parkinson's community to easily query and download available materials. Resources will be easily found using a search browser that will provide access to the resource, its source, and associated contact information. The website will also host a forum that will facilitate an interactive space for individuals and organizations to start conversations, find common areas of interest, and foster global collaboration based on best practices.
We want to develop an organisational support program, connecting those organisations amongst us who have gaps with those who have valuable resources and skills to share across health, communication, finance, and governance. If you have a need or are a well-resourced organisation, let us know. Our ask today is that you put your hands up and enable us to connect you all.
And with that, we have come to the end of our presentation. Thank you so much for your time. We really hope you enjoyed it, and we hope we've been able to shed some light on the importance of collaborations and building global relationships. As a group, we're looking forward to connecting with you in the live segment of this presentation. Thank you.